Hi, my name is Sister Amy and I work for Bonita's Baby Line. Today we're going to be talking about a few different subjects that you might see with your baby now that your baby's been born. You might feel a little bit overwhelmed, you might feel like you're not sure what you're doing, but today we're going to talk about some of the common issues that are faced with new moms. First being gassiness. So you might hear that your baby's tummy's rumbling a little bit, your baby might strain when baby's trying to poo, go red in the face, or clench his fists. Just be aware that this is completely normal as baby's digestive system has not fully developed as yet. What you can do to relieve your baby's fussiness is to put baby in a nice warm bath. You can do massaging on the tummy every night before a bath, and you can also do bicycle movements with the legs. Another complaint is constipation. Just be aware that babies that are breastfed can go 7 days without passing a bowel movement and can have 7 bowel movements in 1 day. A formula-fed baby can go 3 to 4 days without passing a stool. If you feel like your baby is constipated, what you could do is do some exercises with baby's legs. In a nice bicycle movement for 2 minutes, try and release baby's tension in the legs and in the stomach, and also put baby in a nice warm bath to relieve the stool that might be lodged into the anus. If you are very worried, please consult your doctor as well, and there's no need for babies to receive any water until baby is at least 6 months old or according to your pediatrician. Remember, with water, it can cause a sodium imbalance, an electrolyte imbalance, and this can hurt your baby. So please be aware of not giving water until that age. Another thing we can talk about with constipation is baby's stool. With baby's stool, remember, at the beginning of birth, when they are born, they're passing meconium. Meconium is a dark, black, sticky substance, and it looks very tar-like. A few days following birth, it might be a little yellow, bitty green, and then eventually it will go brown. Your baby does not have diarrhea if your baby's passing more than 7 stools a day, unless it's very watery and baby showing signs of dehydration. Dehydration includes a soft fontanelle. Where their head is, you'll feel that it's very soft. Baby is looking very dry in the face, there's no tears, and baby has less than 1 wet nappy in 6 hours. Remember, babies need to pass at least 6 to 8 wet or dirty nappies in a 24-hour period. Next, we'll talk about breastfeeding. Breastfeeding is difficult for a lot of women, and it's very often a lot of perseverance involved. But if you are able to do it and you would like to do it, then great. Breastfeeding is tricky. So what you need to do is, when your baby is ready to feed, make sure that your baby is dry, make sure that your baby is comfortable, and make sure that you are sitting correctly. You cannot feed a baby if you yourself are not ready. Sitting comfortably in the chair, with your water next to you, because we need to keep hydrated, keep your baby in a horizontal position, okay? Make sure that baby's tongue is down, and make sure that baby's nose is open, okay? When feeding, express a little bit of the milk so baby can smell it and latch baby. If baby is struggling to latch, just remember you can consult a lactation consultant or you can phone your pediatrician. With breastfeeding as well, many mothers don't understand if baby is full or not. Remember, if baby is having 6 to 8 wet or dirty nappies in a 24-hour period and gaining weight adequately, then your breast milk is more than enough for them. With baby's weight, when baby is born, baby will lose 10% of their body weight in the first 7 days. Okay, so when baby loses its weight, it's because baby was in water. Now that the water has been released from baby, they tend to lose weight. On day 10, baby should be the weight that they were born at. If they are not reaching that, you need to consult your doctor or you need to include extra supplementary feeding. Okay, with formula babies do suffer from constipation a little bit more if you keep changing formulas as well. Okay, if you find a formula that fits your baby, then wonderful. Once you change a formula, because of the different enzymes and proteins in the formula might constipate them. When you find the right formula, stick with that formula until baby's 6 months old, or you begin solids according to the age that your doctor has recommended. With formula feeding, make sure that babies latch correctly onto the bottle and that baby is sucking without too much air. Okay, very often the trapped air and the trapped wind causes the fussiness, causes the discomfort in your babies. And that's also important to rub their tummies or give something that, will make baby better, like the drops on the market. You might also notice that with formula babies, their tongue gets very white. There's no need to remove the whiteness off their tongue. It will evaporate quite quickly. If you are concerned that there's a buildup, you don't need to give glycerine. Remember, glycerine has got added sugar. We don't want the babies to have any added sugar. So just take a clean, damp face cloth and wipe baby's tongue in a once-off movement to remove the excess residue. Now, with formula babies, always remember that when you are making the formula, to read the tin and give exactly the right measurements that babies need. Otherwise, this could lead to a decrease in weight or an increase if not given correctly. When you are mixing the formula, give a level spoon and put it in the water, not vice versa. Don't put the formula in and then the water. It's always the water to the specific amount and then the level spoons into that water. When you shake the water, don't shake it, stir it round so you don't kill all the good proteins in it, and also don't freeze the milk. With the formula, you can leave the formula up to 24 hours in the fridge, but it must not be outside in room temperature for longer than 1 hour. This can cause diarrhea, this can cause viral infections in babies, and they can become very uncomfortable. Breast milk, however, is the right temperature, the right consistency, and the right amount for your baby at all times, and your breast milk will change. Very often women who express find that they have more breast milk in the morning and less breast milk in the evening. This is nothing to be concerned about. It's your body's way of adjusting to meet the needs of your baby. Okay, next we'll be talking about reflux. What reflux is, it's an acid buildup sitting in the chest that babies sometimes vomit. You might notice sometimes the milk comes out the nose, milk comes out the mouth, and baby has a spit up. Spit ups are completely normal. It's also important to not overfeed your baby. Very often when their stomach is too full, especially the moms that mixed feed, so formula and breast, baby's getting too full and the milk comes back up. There's no reason to be concerned unless your baby is showing signs of discomfort or fever. Okay, so if there's any flu-like symptoms that accompany it, baby's coughing excessively, baby's turning very red, baby's not breathing well on their own, or baby's got a temperature, then take your baby to the nearest doctor. Next, we're going to talk about skin conditions. Very often when a newborn is born, moms think that baby should have a flawless skin, and very often this isn't the case. Normally, a condition called erythema toxicum occurs in the first 2 to 4 days after birth. Erythema toxicum is a completely normal skin condition that goes away within a few days. The cause of this is unknown, but it's normally thought that when babies are earthside, their skins are adapting to our temperatures. This is no need to scrub any of the pimples off. You don't need to apply anything. You just need to pat baby dry and keep baby moisture free. Next, we're going to talk about baby acne. Baby acne usually happens between 2 and 4 weeks of baby being born. When baby acne arrives, it might start on the face, work its way down the arm and onto the back. Mothers become generally very concerned about baby acne, but there's no reason to be concerned. Baby acne is a hormonal change. So what happens is when baby's in the womb, in your stomach, baby is getting all its hormones from you. Now that baby is born, baby's making their own hormones and needs to excrete all the hormones that you've provided for them. When they excrete these hormones, it usually arrives in the skin. There's no need to pop the pimples, break the pimples, scrub the pimples off, or apply anything to them. This will go away by itself, and all you need to do is apply aqueous cream. Also remember, it's important not to bath baby every day, as we're stripping the skin of its natural oils. Every second or third day is completely fine, as babies don't generally get very dirty. What we're going to talk about next is a diaper rash or a nappy rash. A nappy rash happens when there's an excess fluid buildup on the skin. So if baby's been in their nappy for too long, their nappy rash will become inflamed, sore, and red, and it might burn them. What you need to do is, and it's very important, to change baby's nappy as soon as they've passed urine or had a stool. Also, if you are worried about baby's nappy rash and it's becoming open, there's any blisters, please consult your doctor or pediatrician. With a nappy rash, you can apply a good bum cream, let baby's nappy dry, and always change baby as soon as you can. With nappy rashes, it's important that baby's nappy is not on too tight, not on too loose, and that you're using a good brand. Next, we're going to talk about milia. Milia is a white little pimple on baby, and it is completely normal. It usually happens between 6 to 8 weeks, and the cause of this is also unknown. If you are concerned about any rashes, then please consult your doctor or pediatrician, and especially if baby's presenting with a rash or any flu-like symptoms such as a fever, cough, runny nose, or difficulty breathing. Should you require any further assistance, please feel free to phone us on 0860 999 121. You can call us any time of the day or night, weekends and public holidays included. A midwife or pediatric sister will be able to help you at any time with any of your health questions you may have.